Right now, your legs and feet might be sending you quiet warnings about your heart, but you might not be listening. In the United States, more than 6 million people are living with congestive heart failure. And here's the shocking part. For most of them, the first signs don't appear in the chest. They appear in their legs and feet. What feels like just swelling or just aging could actually be your heart's first cry for help. When your heart starts to weaken, blood doesn't circulate as it should. Your legs, being the farthest from the heart, become the first to show distress, often long before shortness of breath or chest pain appears. Yet, 94% of people ignore these symptoms, thinking it's just fatigue, standing too long, or poor shoes. But these small signs can mean the difference between early treatment and a medical emergency. So if you've noticed changes in your legs or feet, coldness, swelling, color changes, don't brush them off. Today, you'll learn about 12 early symptoms of congestive heart failure that show up in your legs and feet. Each one tells a story, and together they can help you protect your heart and possibly your life. Symptom Group 1, Circulation Warning Signs. 1. Cold feet. If your feet are often cold even when your hands are warm and you're under a blanket, it might not just be poor circulation. When the heart struggles to pump blood effectively, it has to make a choice: where to send the little blood it can move. Your body prioritizes vital organs, your brain, heart, lungs, and kidneys, and your feet fall to the bottom of the list. Research from Circulation, one of the world's leading cardiology journals, shows that people with reduced cardiac output often report chronically cold feet as one of the very first symptoms. Here's what makes it different from normal cold feet. They stay cold no matter what you do, even when wearing thick socks or moving around. It's as if your body is trying to keep the inside warm at the expense of the extremities. That's your heart telling you, I'm struggling to reach you. 2. Pitting edema, the finger test. Try this right now. Press your thumb firmly into your shin or ankle for about 10 seconds, then let go. If a deep dent stays there for a few seconds, that's called pitting edema. Doctors use this simple test to identify fluid retention caused by right-sided heart failure. When your heart can't pump blood back to the lungs efficiently, it builds up in your veins. Pressure rises, forcing fluid out of your blood vessels and into surrounding tissues. That's why your legs swell and that dent remains after you release your finger. It's not just water weight, it's a message that your heart is struggling to move blood the way it should. 3. Sudden muscle weakness in the legs. If climbing stairs or walking to the mailbox suddenly feels like climbing a mountain, your heart might be part of the reason. A major study published in Circulation, Heart Failure, found that people with congestive heart failure often lose muscle protein, specifically the protein that helps muscles contract. Without enough oxygen and nutrients from the blood, your muscles literally weaken on a cellular level. Even after medications improve heart function, this weakness often lingers because the muscle fibers have changed structurally. So when your legs feel unusually tired or shaky, even after rest, don't just assume it's aging. It might be your muscles crying for oxygen that your heart can no longer fully deliver. What you can do for Group 1. If you've noticed cold feet, swelling, or sudden weakness, it's time to act. Schedule a heart evaluation. Ask your doctor for an echocardiogram and a BNP blood test. These simple, non-invasive tests show how well your heart pumps blood. Move every day. Even 10 to 15 minutes of slow walking or stretching boosts circulation. Elevate your legs for 15 minutes daily. It helps blood return to your heart. Reduce salt and processed foods. Too much sodium traps fluid in your lower body. Stay hydrated. Mild dehydration can make circulation even worse. Your goal is simple: help your blood move, not pool. Symptom Group 2, Fluid retention signs. 4. Rapid weight gain overnight or in a few days. You step on the scale and notice you've gained 5 to 10 pounds in just a few days, but your eating habits haven't changed. That's not fat. It's fluid retention, and it's one of the most alarming signs of heart failure. The Mayo Clinic lists sudden weight gain as an urgent red flag. As your heart struggles, your kidneys receive less blood flow, causing your body to hold on to sodium and water. This trapped fluid shows up as swelling in your legs, ankles, and even your abdomen. If your pants feel tighter around the calves, or your shoes suddenly don't fit, take it seriously. Fast weight gain, especially in the lower body, is your heart's emergency signal. 5. Bluish or purplish legs, cyanosis. When you look down and see your feet or legs turning bluish, purplish, or dusky, that's called cyanosis, a clear sign your blood lacks oxygen. In heart failure, blood moves too slowly, and oxygen-depleted blood starts to dominate circulation, especially in areas farthest from the heart. Gravity pulls this poorly oxygenated blood downward, which is why discoloration starts in the toes and creeps upward. This isn't a cosmetic issue, it's your cells starving for oxygen. When tissues don't get the oxygen they need, they change color like a warning light on your body's dashboard. If your skin looks tinted blue or purple and doesn't return to normal after warming up, get it checked right away. 6. Persistent swollen ankles. Ankle swelling is one of the most visible and reliable early signs of congestive heart failure. Unlike normal swelling that goes away after rest, this one doesn't imagine traffic backing up after an accident. Your weakened heart is like that blocked road blood starts backing up in the veins, especially in your lower body. This extra pressure pushes fluid out into the surrounding tissues, causing persistent swelling. According to the Journal of the American College of Cardiology, ankle swelling isn't just a symptom, it's also a predictor of how the condition may progress. If your ankles look normal in the morning but are puffy and tight by evening, that's your heart telling you it's under strain. What you can do for Group 2, how to manage fluid retention safely. If swelling and fluid retention sound familiar, call your doctor if you gain more than 2 pounds in 24 hours or 5 pounds in a week. Ask about diuretics, water pills, to help your body release fluid but never start them on your own. Limit sodium to 1,500 to 2,000 milligrams per day. Read labels carefully. Salt hides in canned soups, sauces, and bread. Add potassium-rich foods like bananas, spinach, and avocados unless your doctor says otherwise. Sleep with your legs slightly elevated and avoid sitting or standing still for long hours. Consider compression socks to improve blood flow. These simple habits help reduce swelling and make your heart's job easier. Symptom Group 3. Oxygen and nerve warning signs. 7. Slow healing wounds or sores on legs and feet. A small cut or sore that refuses to heal for weeks or even months is not just a skin issue, it's a circulation problem. Heart failure limits the oxygen and nutrients reaching your tissues. Without that oxygen, your body struggles to build new cells and fight infection. Research in the Journal of the American Medical Association confirmed that poor cardiac output significantly delays wound healing. When your heart can't pump efficiently, even tiny injuries can become serious. If your feet have scabs, blisters, or ulcers that linger far too long, see a doctor. Your body might be telling you that your blood isn't reaching where it's needed most. 8. Leg cramps or pain when walking, claudication. If your legs start cramping or aching after just a short walk, it's not just tired muscles. Doctors call this claudication, and it often happens when your heart can't deliver enough oxygenated blood during movement. In a study from the Journal of Cardiac Failure, patients with heart failure frequently reported severe cramping and fatigue in the calves after only light activity. At first, it might happen when you climb stairs or walk uphill. But as heart function declines, it can happen even while walking across a room. This pain is your muscles saying, "We can't breathe." Don't push through it. This is a serious circulation signal. 9. Restless legs at night. You finally lie down to rest, but your legs seem to have a mind of their own, twitching, tingling, or creating an irresistible urge to move. This sensation, called restless leg syndrome, affects nearly 80% of people with heart failure. Why? Because of fluid redistribution. During the day, gravity pulls fluid down to your legs. At night, when you lie flat, that fluid moves back toward your core, irritating nerves and altering electrolyte balance. It's like your legs are reacting to waves of fluid moving through them. This can cause burning, crawling, or tingling sensations that keep you awake, leaving you exhausted the next day. If restless legs disturb your sleep regularly, it may not just be nerves. It could be your heart's way of saying, "I'm overloaded." What you can do for Group 3, improve oxygen flow and night comfort, stretch before bed. Simple ankle rolls and calf stretches relieve pressure. Massage your legs or use a warm compress to improve oxygen flow. Avoid caffeine, alcohol, and large dinners before sleep. They worsen restless legs. Check your iron, magnesium, and vitamin D levels. Deficiencies can make these symptoms worse. If wounds are slow to heal, don't wait, schedule a vascular or heart check. And prioritize sleep. 7 to 8 hours of rest helps your heart recover every night. The goal here is to restore calm to both your legs and your heart. Symptom Group 4, structural and sensory changes. 10, sudden worsening or new varicose veins. If you've had mild varicose veins for years, but they suddenly worsen or new ones appear quickly, it may be linked to your heart. When your heart weakens, pressure increases in your entire venous system. That extra pressure stretches the fragile one-way valves inside your leg veins, causing them to fail. A study in Vascular Medicine Journal found a strong correlation between heart failure and the rapid progression of varicose veins. So if your veins are bulging, painful, or multiplying rapidly, don't dismiss it as aging. Your heart may be sending pressure backward through your veins, and that's never a good sign. 11. Shiny, thin, or tight skin on legs. When you look down and notice your skin looks stretched, shiny, or unusually smooth, it's not just a cosmetic change. This often means fluid retention has altered your skin structure. Your skin is like an elastic balloon. When too much fluid builds up under it, the surface becomes taut and reflective. Doctors often use this shiny skin appearance as a diagnostic clue for chronic heart failure. It can also make the skin fragile and more prone to tearing. If your legs look like they're polished, it may be because fluid has been building quietly beneath the surface for weeks or months. 12. Numbness or tingling in the feet. That pins and needles feeling or complete numbness in your feet may not be from your shoes. It can be caused by nerve compression and oxygen deprivation due to swelling. When fluid accumulates around your feet, it squeezes small nerves responsible for sensation. At the same time, reduced blood flow deprives those nerves of oxygen, causing them to misfire. You might feel tingling one moment and numbness the next, like walking on sand or cotton. In advanced cases, you may lose sensitivity altogether, increasing the risk of unnoticed injuries or infections. Your body is sending distress signals through every nerve fiber. The question is, are you listening? What you can do for Group 4, protect your legs and your future mobility. Wear comfortable shoes with soft soles. Avoid anything too tight. Don't stand still for too long. Move or stretch every 30 to 40 minutes. Ask your doctor about a Doppler ultrasound to check blood flow in your veins. Try gentle exercises like walking, swimming, or cycling as they help blood return to your heart. Stop smoking. Nicotine narrows blood vessels and worsens circulation dramatically. Keep your legs moisturized. Dry, stretched skin tears easily when fluid builds up. Remember, your legs are the farthest point from your heart. Treat them as your early warning friends. Hope segment. Now that we've gone through all 12 symptoms, here's the most important truth. Your legs and feet are not your enemies. They're your early warning system. They're trying to save you before it's too late. The encouraging news? When caught early, heart failure is highly manageable. Medications, lifestyle changes, and improved circulation can dramatically slow progression and even reverse some symptoms. Simple actions like walking daily, reducing sodium, drinking enough water, and maintaining healthy sleep can make a powerful difference. Your body is remarkably resilient when given the right care. Remember, these signs are not punishment. They are your body's way of saying, "I still want to fight for you." Lifestyle Blueprint. Here's what cardiologists recommend to strengthen your heart and legs together. Eat for circulation. Focus on Mediterranean-style foods. Olive oil, salmon, nuts, berries, green vegetables, and whole grains. Limit salt and sugar. Avoid processed meats and canned foods. Move daily. 20 to 30 minutes of walking, swimming, or cycling improves heart output. If you can't walk far, do ankle rotations or seated marches. Small moves still count. Watch your fluid balance, track your daily weight. A sudden increase could mean water retention. Drink water regularly, but follow your doctor's advice if you're on fluid limits. Sleep and stress. Sleep 7 to 8 hours each night. Practice slow breathing or meditation to reduce heart strain. See your doctor regularly. Ask about your blood pressure, cholesterol, and blood sugar. Get your heart checked yearly, especially if you're over 60 or have diabetes or hypertension. Stay connected. Social isolation increases heart disease risk. Spend time with family, volunteer, or join a senior fitness group. Your future heart health is built on daily choices, and every heartbeat you protect today adds time, energy, and life to your years. CTA, the final message. If you recognize several of these symptoms, not just one, don't ignore them. Call your doctor. Get a heart evaluation. Early intervention can mean decades of better health instead of a sudden emergency. If this video opened your eyes, please give it a like, and more importantly, share it. Someone you love might be living with these same signs right now, unaware of what their body is trying to say. And if you care about living stronger, longer, and wiser, subscribe to Elders Living Better, where we share science-backed health tips to help you live your best years with clarity, confidence, and heart. Because sometimes what your legs are whispering could be the message that saves your life.